Back on Morning Line. Thanks for joining us on this Tuesday. Nick Barris here, and we're talking allergies with Dr. Yasmin Khan, who's with us this morning, and Dr. Donna Hummel. Both of you over at Vanderbilt Medical Center. It's the allergy clinic there. Is that correct?
Yes, we have allergy clinics for adults at Vanderbilt Allergy, Sinus, and Asthma program on West End. We have a pediatric allergy centered at the Vanderbilt Health at 100 Oaks. And we also have just started a clinic for children who have immunodeficiencies, and we're centering that at the Doctor's Office Tower at Children's Hospital.
Okay, and well, the two of them also do have an emphasis on pediatric allergies and that, and we'll touch on some of the things you're working on that. So, you know, allergies obviously affect children a lot as well, so we can get into that if you have a question. Let's take a quick call from Imogene, who waited through the break. Hi, Imogene, go ahead.
Okay, I would like to ask, what do you do when the fluid gets in your ears?
The glugging in the ears. I hear you on that. That's awful, isn't it? Do you get an ear infection or an earache because of it?
No, it just feels stopped up, and my daughter recommended a leave for sinuses, and I got some. I took one Saturday, I took one Sunday, and I took one Monday, but it made me so dried out, I didn't take one today. But my ear's still stopped up.
All right, good question. Yeah, clogging of the ears, how about it?
That is probably related to mucus just sitting there and not being able to move, mucus and fluid. So starting a nasal steroid spray would probably be a good idea for Miss Imogene, but it will take a few days for her to see any benefit.
Okay, would that be an over-the-counter one or a prescription?
It certainly can be. Her primary care doctor could prescribe it as well.
Okay.
Any of the nasal steroid spray.
And so what we're talking about here is not the Afrin, but we're talking about, Imogene, when you go to the pharmacy, or if you go to your Kroger and go to the pharmaceutical section, they've got Nasonex is one of them, right? That's over the counter.
It would be Flonase or Nasonex. Nasacort is also over the counter.
That one.
I'm not sure that Nasonex is over the counter.
Okay.
But Flonase and Nasacort definitely are.
And again, those are steroidal sprays, which
Correct.
hopefully would then shrink the swelling in the tubes or whatever there and allow the fluid to run free then.
Drain and help you stop making all the extra mucus that people tend to make when they are exposed to pollen.
Yeah, I think does that make sense to you, Imogene?
What about the neti pot? Would that help?
It will. Sometimes when you already have fluid in your ears, it will make you feel like you are getting more. That certainly happens to some people. It would be worth a try, though, because it may very well help you.
If you use neti pot and the nasal sprays, does the neti pot wash away what you sprayed up there? So do you want to do the nasal spray afterward?
Correct. And that is really the perfect regimen, to use your neti pot or any kind of nasal rinse and then use your nasal steroid spray, because as you can imagine, you're then spraying the medicine on nice, clean nasal tissue.
No, absolutely. So it gets to it and it's maybe perhaps more effective that way.
Correct.
Okay. As far as people, I just want to hit some of the real basic stuff. The eyes and the itching. I know some of these treatments we just talked about can help with that. Is there, eye drops? I've heard people say getting the red out Visine, but Visine can dry out your eyes, I guess, to some degree. What do you recommend? Are there any drops for your eyes that would take away the itching, maybe clear them up if they're bloodshot?
Yes, there is an ingredient called ketotifen, which is the generic name for an antihistamine that's available over the counter in eye drops now. And brand names might be Zaditor or Alloway, and they can be used.
What does that do when you put the drop in? That's to take away the itch or to clear the eye? Or
so it has an antihistamine effect without a whole lot of drying, and that particular molecule also is an anti-inflammatory to some extent without being a steroid.
Okay.
So it's helpful to be using that if you have eye problems.
All right.
Many people who have eye trouble also find that just using a regular nasal steroid spray helps their eyes, even though they're not spraying it in their eyes. There is a connection. So similar to what we said before about the nose being connected to the lungs, the eyes are connected to the
Everything
nose.
kind of linked. That makes sense. That makes sense.
Right.
Every once in a while this time of year, too, you'll see people walking around with those surgical masks on. Or a bandana across their face when they're mowing a lawn. Are you wearing a filter? Is that, what do you think?
The best filters are the ones that are actually certified for that purpose, but we do talk
really?
about 3M filters, the HEPA type masks that some people would use.
Those are certified for, yeah, I wasn't even aware.
For
I
very
didn't know.
fine particles.
For very fine particles.
Yeah,
It's
because
like,
fabric is not certified for fine particles.
well, right. Yeah, I don't know if the other, yeah, would a bandana, it would keep dust maybe out of my throat.
Somewhat.
But so there's certain types that you can buy over the counter that, the ones I'm trying to think, they kind of have the elastic band around the ear and it's just a white
Yes.
Exactly.
over the nose and mouth.
Yes, and they seal pretty well
Okay.
on the face.
Of course, walking around with something that on your face.
If you're in the middle of mowing your lawn, I don't think you're
I think that
too
exactly.
worried about
Depending on
fashion
what it is,
statements.
you're absolutely right. And if it's going to make you feel better, yeah, I mean, you couldn't wear it to work here, but that's a good idea. Now, as we mentioned, you do a lot with children as well, correct? And it's not all just the seasonal allergies, but you were telling me about a couple of things. A trial, one big thing for folks, if you're watching, dealing with peanut allergies, right?
Yes, the last year has been pretty exciting on the food allergy front. There was a clinical trial that was centered in the United Kingdom called the Learning Early About Peanut trial, the LEAP trial, L-E-A-P. And the results of that trial were presented a year ago, and they showed that the early introduction of peanut as a snack to infants in the first year of life could actually reduce their development of peanut allergy.
Now, okay, that's interesting. Explain to me again why all of a sudden we started seeing over the last few decades so many children suddenly, it seemed like, becoming allergic to peanuts. Why? Is that because they were eating too much of it later in life, or what? Where did that come from?
Well, unfortunately, over the previous decade, doctors and allergists mistakenly were giving the advice to families to avoid feeding peanut products to their children until the age of 2 or 3. And it looks like that was probably the wrong advice.
Oh, okay. So, but that doesn't explain to me why there were so many peanut allergy reactions now. I mean, is it out of the blue? I mean, I ate peanut, but when I was a kid, I don't remember a bunch of people having peanut allergies. Airplanes had peanuts, and I know they're bringing them back, all this. But now, I mean, my son has friends that come over, and man, we have to clear out the cupboard of anything with peanuts from this guy. I don't remember that when I was a kid. So why did it all of a sudden get bad, peanut allergies? Or were we just missing it back then?
We don't think it actually suddenly got bad. I think it was a gradual trend beginning somewhere in the 1990s. And certainly our entire Western civilization was changing over that time period. All allergies have been on the rise, not just food allergies.
Is that right?
Yes, every allergy you can name has been on the rise.
Is that because we as humans are becoming more sensitive to things? We're losing our tolerance? Why all of a sudden?
You said the magic word. The magic word is tolerance, and we have been losing tolerance. But there are genetic reasons for that, but there are also going to be environmental reasons for that. And we haven't really completely sorted out all of those different issues, which ones are the most important. It seems to be a very complex process.
But we're evolving, our bodies are changing in this way. So the study out of England then with peanuts is showing then that possibly now families should feed their infants or give them exposure to peanuts earlier and just early on.
Yes, as a matter of fact, there was a consensus statement that was published in the September 2015 issue of the journal Pediatrics. So the American Academy of Pediatrics has joined the consensus that the early feeding of peanut to children can really be helpful to them in protecting them from the development of peanut allergy. Of course, there are some concerns because there may be some infants who have already become sensitized.
So you got to watch them, right?
And so there are going to be individuals who are considered at higher risk. And it would be wise for those families to speak with their pediatricians or potentially see an allergist before they begin the introduction.
Gotcha. We're going to take a break on that note. When we come back, we've got more phone calls for you. Is that all right? Stay right there. We'll be back with more right after this.